Good morning and good afternoon, and welcome to the Weekend Wellness Hour show. Today, we have a recent new friend. We connected a few months ago, and we're going to have Amy Rinkevich join us today to talk about a type of treatment modality called craniosacral therapy. So Amy is going to join us. She has over 20 years of experience in this realm and can't wait for her to share. So thank you so much for joining us today, Amy.
Thank you. I really appreciate your interest and reaching out. Always excited to talk about craniosacral therapy.
Wonderful. I'd like to learn, how did you even get into this field? I know you're a registered nurse, and so how did all that happen?
So yes, my background is in nursing. So I am a registered nurse and have worked in a lot of different settings. Mostly pediatrics is my background, but I've been in hospital, home care, clinics. And fortunately, I always got the feeling when I went into nursing that the word that I knew back in the day was preventative. Like I wanted to do preventative, work in preventative healthcare. And I didn't know exactly what that meant. And then when I found craniosacral kind of found me, a dear friend who's a massage therapist found craniosacral, started studying it, knew me really well, and just knew that it would be a fit, and it was. Massage therapists often are the ones adding to their toolbox. They're really tend to have a lot of modalities that they use, and she kind of walked me into it. I was, moving and having children and things like that. And eventually my kids actually went down, she was in a pediatric class. And so they were the demos for the class. And after that, I was completely sold. And the beauty of it is it definitely married the two works. My nursing training, which is much more allopathic and traditional, obviously, and that desire to look for a root cause and more wellness model. And this work really bridges that. It is definitely comes more from a wellness model than illness model. So I had to unlearn some things, and really learn to just work with empowering, just helping people feel empowered and trusting their body. And it's just been such a lovely journey. I never stop learning, and I'm a forever student of this work.
Yeah,
it's lovely.
And the word you said about empowering people about their bodies, that's actually really difficult. And a lot of times we don't almost believe in that. We think that things happen to us and we have to get help from someone. And a lot of times it's warranted, but a lot of times we don't feel very empowered, and we feel almost this loss of control over how we feel and how our body performs and acts and behaves. So I'm glad to hear that you had to go through that transition and you found this type of treatment that can really empower people.
Right. We look for what's working, not what's wrong. And that just right off the bat is so fun to see people. Sometimes we're the last stop. People have done everything else, and it can be the first time that they're really, we're interested in it, and what's going on. What do you think's going on? And let's work with what's working in the body. And it's always, the body's always trying to self-correct and find perfect health. And that's the premise that that's why this work works, because that's the premise that it's based on. And so there's a inner healing mechanism that's always at work. There's just roadblocks. There's something that's gotten in the way. And if the body could have already taken care of that, it would have, So that's really what we do with this work. And I know, I can go into more of the detail, but it is about helping the body free up any blockages so that it can take it from there. So that may be the first time that I've ever heard that. It's fun to see them kind of reestablish that relationship with their own body and reestablish trust, because that's sort of that's not supported in a lot of more traditional medicine, for sure.
Right. Yeah. And let's actually dive into what exactly craniotherapy is, craniosacral therapy, and what do you mean by blockages? Like, can you dive into that? Kind of give us some of the basics of what it is, the anatomy you're working on, and kind of all of that.
Yes, absolutely. So craniosacral therapy is a light touch body work.
Mhm.
And it's very, so just to kind of give you the setting, I'm sitting in my treatment room right now, and it consists of a massage table, and that's it.
Okay.
So the person stays fully clothed. I work from newborns all the way to 90-plus-year-olds, fully clothed, and you recline, relax on a massage table. So it's a very light touch. And when I talk about blockages, what we're really talking about is tension patterns that are in the soft tissue mostly. So when I say soft tissue, another word I'll use is connective tissue or fascia. And I'll just use those interchangeably as I talk. And so some people might be more familiar with one versus another. And we find that a lot of times the issues are in those soft tissues. They don't show up on CAT scan, MRI. Yeah. So a lot of times people find their way to craniosacral and they say there's nothing wrong, but I'm in pain. So what we're trained to do really lightly is to work with that fascial body and feel through the tissue and find where there is tension. And because it's connected, there can be tension way down in the left leg that's found its way all the way up to a right ear, and someone has vertigo. So we're trained to follow that tension pattern, and we find that fascia releases much more easily with a light touch. If we go and there's definitely a place for deeper work, it's just not what craniosacral is. So we find that fascia, if we find where that tension is, the body is already working on it. It is trying, and what we do is we wait, and we'll feel a little bit of movement, and then we follow. So we follow and facilitate. That's also so empowering, because when the person will start to feel some movements, very subtle, then we get to say, yeah, that's your smart body. You just freed up. And so what we use is about 5 grams of pressure. I always have a little nickel around, so that you can kind of imagine if you put a nickel on your hand or your arm, that's 5 grams. And so again, fascia response are really light touch. So we offer, less than, maybe a little bit more than, but that kind of right in that rough area. And we go, so we'll feel a little bit of movement, the body trying to get unstuck, and we follow that, facilitate, and then we'll feel lots of movement. Sometimes we feel heat. Sometimes there's a softening, pulsing. There's different signs of release. So that's what when I say blockages or roadblocks, that's what I'm referring to. Okay. And really, almost all modalities, whether it's acupuncture, massage, chiropractic, that's what we're all trying to do, is help the body get roadblocks out of the way, get unstuck. Right. Because then the body takes it from there. It's always, the credit always goes back to the body, right? It's the one that takes it, the extra, takes it from there, like I said, and gets back to perfect alignment, perfect health, with all the and craniosacral. So we're all just working with different mediums, right? So craniosacral, we're working with fascia. And then what makes this work a little different from other energy work or myofascial work is that we're focusing on what's called the craniosacral system. So we have that fascial tension, and it literally connects from our toe to the top of our head. And in there is the container to the central nervous system. And when I say central nervous system, I literally mean the brain and the spinal cord. The spinal cord comes way down into the body, but it's just an extension of the brain. And we have a container. So around the spinal cord is the dural tube, which a lot of people are familiar with. And then that dural tube, literally the same tissue, it's just a different kind of fascia, but it moves up and then surrounds the brain and creates a membrane there. Right. So the tension patterns that we find can influence and pull on and tug this container. So we can have some tension in the spinal cord, or the nerves coming off the spinal cord, because the fascia is now involving the craniosacral system, or that container. So, and the other thing that's part of that, of course, is the cerebral spinal fluid that surrounds the spinal cord and bathes the brain. And if everything's nice and free, the dural tube slides and glides along the vertebral column.
Mm-hmm.
And then also the brain is nice and it's floating and it's being bathed by cerebral spinal fluid.
Mm-hmm.
I got my little skull here because on the inside, there's nothing like a visual
Yes.
tool, right? So on the inside, you can see this white model part of the model here is membrane. So you can see that it attaches the inside of the cranial bones.
Mm-hmm.
So what we do when we get to the head is we also then feel how the skull feels. And if those membranes are nice and free. Now, this model is, hard, but the membrane is made out of a pliable, tissue. So it can easily, if there's a tension or a blow that comes to the head, then it can be torsioned or pulled, or tension can then be brought into this that then also then pulls the cranial bones.
Right.
So that we can feel, we're trained to kind of feel how those feel, and do they feel, we're using the bones as handles to see what that membrane system feels like.
That's incredible.
So if the brain is being squeezed or compromised in any way, because of the central nervous system, it contributes to everything. It can in different bodies manifest in different ways. Same for the spinal cord if that dural tube is being pulled on. So that's a lot of words.
No, that's amazing. And so when someone comes in and you said they're fully closed, they're on a massage table, are they on their back or are they on their stomach?
Almost always. There is an occasion that we have people on their stomach, but almost always, I would say, 80-90% of the time they stay on their back.
Okay.
So yeah, and then we use bolsters or pillows, so some people, that's the hardest part, is lying flat on their back. So we make sure that they can totally relax and land.
Yeah.
And when the body can relax, then it starts presenting and starts showing, where it needs help. And that's where we're trained to kind of pick up on. And again, it's with really light touch. It's, it's pretty amazing. Yeah.
So do you start at the head and work your way down different aspects of the body? Actually,
it's typically the other way. We typically start at the feet, and I'll spend the first 5 minutes almost every session, definitely if it's a new client. And there is what we call a cranium. I'm glad you brought that up, because this is kind of how do we assess, how does the body tell us, where its issues are, and it's beautiful. The body will choreograph and tell us, where to start and in what order. And I generally start at the feet and move towards the head. Now, because the body is constantly making cerebral spinal fluid in the head and pumps it up and down the spinal cord or the dural tube, that creates a widening and narrowing that we can feel, the flexion extension, we call it, that we can feel in the body, and it's called the craniosacral rhythm. And excuse me, so with, again, the very light touch, we can in the first 5 minutes or so, I'll move from the feet up to the head, and we're getting ideas. If one side's not moving, it may be asymmetrical. There may be a part of the body where it's not moving as much. There may be a different quality where it's not smooth. So we're taking all that information in, and because it also can be kind of intimidating for somebody to just start with the head, but also we know that there's two ends of the rope, that's why it's called craniosacral therapy. Often attention, and somebody may come in with migraines and a lot of pressure in their head and their whole tailbone. So sacrum is another word for tailbone. That's where the name comes, craniosacral. The tension may be coming all the way down the pelvis and in the sacrum. So we find that that's the reason we assess the whole body and we work wherever the tension is. So sometimes people just hear cranial and they assume that this is head work, and that there'll only be, a lot of people hear that they're just going to be working on the head. So we just kind of explain that first of all, we treat what we find in the order the body shows us. It's kind of like following breadcrumbs, and also the whole idea of it is like an onion. And the whole layering idea that I know is a reference to a lot in integrative work. But we do have layers, life events on top of life events. And so the body decides, again, in what order, and by showing it and presenting it with these tension patterns.
That's amazing. And does the length of the treatment depend on the person and the condition, or is it about an hour, half hour? What does that look like?
It's about an hour, maybe a little bit more that first session. But yeah, about an hour. Now, sometimes we schedule either somebody's driving a long ways, or we just find that after about an hour, where the body's just getting into a relaxed state and they need more time. So sometimes it's an hour and a half. It's pretty typical if I'm going to extend one. So I have some clients that do that, but most people it's an hour, even newborns, we only do as much as that body can process. And, so if when the session's over, the session's over, but almost age from 0 to 90 is about an hour, is a kind of a sweet spot there. And sometimes we'll add in a little bit more.
That's great. And so what do people feel like on the receiving
end? Really good question. So one of the things that we hear the most is that they get super relaxed. So a lot of times what most of us are operating under is some low grade, maybe sometimes not so low grade fight or flight. We're in that sympathetic nervous system is the fight or flight. Parasympathetic is the rest, digest, and heal. And we want a balance between those two. We don't want one off and the other on. They work if everything's balanced. Again, and this is what helps to get tension off the brain and the spinal cord. It helps to balance those two. So then when we need to go into fight or flight, we can. When we need to digest our meal, we can, right? But a lot of us are operating in some low grade fight or flight. So that's what a lot of people say. And sometimes it's so not familiar, they'll feel heavy. They'll even say, wow. And I feel like I haven't felt like this in a while, or, but in general, very relaxing. The fun thing is when there's a real blocked area and it starts to open up, the person feels it, and they may start to feel warmth and movement and just vitality, either in that area and sometimes it's later, sometimes it's not on the table. And I always tell people, again, giving the credit back always, but just because my hands are off, the person leaves the session, doesn't mean the body stops working. Right? We've just helped remove some roadblocks, and now the body will continue to process and continue to work. So we tell them to, drink a lot of water. You might be tired, you might be energized, but where there's tension, there's often toxins. So, most of us have had a deep tissue massage and felt a little grumpy the next day or achy. And that can happen even though the touch is super light. It's the same principle. We're freeing up tight areas that can have been holding toxins. So sometimes that's after the fact. But if they drink a lot of water, take an Epsom salt bath, we just really tell them to really, if best you can, really listen to yourself. So it's nice if they can have a session at the end of the day, versus coming at a lunch hour or in the morning. But it's, if that's what they need to do, that's fine too. But it's nice to be able to just really, be able to do whatever the body needs afterwards. But in general, very relaxing.
Yeah, and that's great, because I was going to ask, is there a specific protocol for aftercare after a session? So obviously, sounds like resting, drinking enough. You said an Epsom salt bath. Any other specific things that?
One of the things we say is, if you feel energized, don't overdo it. If you feel tired, rest. Because it can go anyway. Just so that the body has time to process. Babies are the best. They conk out. They almost always are asleep before my clients leave my, street. And that's just the brilliance. They can go to sleep, but also it's just a nice way to process, right? Then we're out of our own way. Basically it is, you can't get this kind of therapy or that kind of therapy, or don't go exercise. It's just listen to your body. If you, need to modify your exercise that day, then do. If not, then just go about your life, right?
Good. Oh, that's great. Now, how do you know if you need this type of treatment?
So craniosacral is very effective for lots of things, as you can imagine, because we're working with the central nervous system, and the central nervous system accesses every system. A lot of times, I will say what put craniosacral on the map, and it's been around for 35, 40 years now. Dr. John Upledger is the pioneer behind this work. And I would say what put it on the map were like migraines. back pain, neck pain, any kind of pain in the body was, and still is very, very effective. I have people that come to see me for everything from anxiety to sleeping issues to, like I said, pretty severe pain in the body. And they typically have exhausted all other treatments. And it could very likely be that the soft tissue hasn't been addressed, right? And then, of course, that container, the central nervous system, hasn't been addressed because the soft tissue's, still tight and tugging. Anybody can benefit from this work. If anybody that gets regular body work and knows how it feels, let's say you get acupuncture, massage, chiropractic, craniosacral, you kind of know when you need what you need, right? And if we're really working with the body to be at our best, then I'm a really big believer in the team approach, right? So when people start with craniosacral, though, we typically say you need to give it 3 to 5 sessions because it's very subtle. So it's definitely not a one and done, just like no other integrative work is. And that doesn't mean you're not getting work up until that point. Now, this is people that come for a specific reason. And like I said, it's very wide range. I have people that come for high blood pressure. They want to get they want to lower their cholesterol. They really just feel like their body's not optimally functioning. And then it can be kind of general. It can be very specific, like pain or headache. But those 3 to 5 sessions, what it doesn't mean they're not getting work from the very first one. It just means that it can be that long before the person can go, oh, okay, this. I feel it. It's sort of like turning a ship. It can take a bit, right? And we want to be turning back towards health, but it might not be, a fast turn. It could be a slow turn. So we really do a lot of education that way, so people understand.
That's great. And so you mentioned obviously pain. It helps people with. People are kind of in that fight or flight mode. Blood pressure. Are there any other kind of common conditions where people would, they have it and they could see a benefit from it doing craniosacral? When
they get the craniosacral, I would say stress management in general, because what happens on the table is the body goes, oh yeah, I have another setting. And so then they have a point of reference again. So in general, they feel more comfy in their body. They feel less stressed. There is, I see a lot of people that have some chronic issues, whether it be, a lot of neck pain, back pain, like I said, blood pressure, a lot of chronic, other big categories, autoimmune. I see a lot of people, and that goes back to the setting again, that nervous system setting. So in general, people will just say, life is easier. I'm just, things I can manage life more calmly now, because now their body has that point of reference. And it may be the first time it's just for an hour. They come and get on the table and like, oh, okay. And then, it doesn't ever go back to square one, but it can feel like it. And then what we're interested in craniosacral is a permanent shift. It's not a dependency. We're not interested in creating like, I'm doing great as long as I'm getting on the craniosacral table every week. You can always get on the craniosacral table every week and continue to peel the onion,
Yes.
But we're looking for permanent shifts. And so that then that setting holds longer. And then we have less tolerance for operating on high or operating in the fight or flight. So that's a general answer, but that's probably what I hear the most, is that just life is easier. Little things don't tend to tip the scale, because their nervous system modulates.
Right.
When it needs to go up, it goes up. When it needs to come down, it comes down. But if we're operating in balance, it's right in the middle most of the time, so that we can fluctuate. But when we get stuck up here, then it doesn't take much at all, and then the immune system and everything else just starts sort of plummeting.
Right. And so obviously when someone's had this type of work done, they need some time to adjust and see, just let their body adapt to this new existence. How quickly does a person need to come back? Is it a week later they come back, 2 weeks? What does that look like?
Yeah, that varies a lot.
Mhm.
But in general, what I like, even again with little ones that don't have the layers we have, I like to get the momentum going. So I often will say weekly for a couple of times.
Okay.
That's not across the board. The good news about craniosacral, but I'm really interested in supporting people's time and resources. So sometimes they can't get back for 2 weeks, 3 weeks, a month. The body will just pick up where it left off. It's just going to, it's going to take a little longer to get through the layers, but it is nice to get the momentum going. So I would say most of the time I see people a couple of times a week apart, and then we start stretching it out every couple of weeks, and then it's as needed.
Yeah,
So
that's great.
but that's super individual. It's
Right.
hard to say. People want to know that though. They'd like to know, how many and how often, and we just don't know. We don't know what that body is going to do with this work, and it may be that person's thing. It may not, so it's all about just trying it, seeing if it resonates, and then finding a therapist that resonate. That's not always a perfect fit. So it's a process sometimes. Yeah.
Absolutely. And when people are looking at it, are there any contraindications or conditions where this is not appropriate, or any risks?
Good question. Really, the only contraindications are a recent skull fracture.
Okay.
That's within like 24 hours, same as a stroke.
Okay.
It doesn't mean that we can't work with that. In fact, I was lucky enough to do craniosacral in our local hospital. I'm in Tampa, and Tampa General is literally in my neighborhood. And so I was lucky enough for 9 years to work at the hospital. And one of the places that we were consulted the most was in the neuro ICU, actually. And we did work with stroke patients. So it's not that it's never okay. It's just that the doctor needs to be okay with any very slight changes in intracranial pressure. So that means we give it 24, 48 hours and check with the doctor. But those folks are in a lot of pain because they've gotten a bleed or blood into and around the brain tissue, which is very irritating. It's not supposed to be there. And so those people have severe headaches, and they found that the pain scores just plummeted. So those would be the two main. Anything that there is a risk if there's a slight change in craniosacral pressure. So that's when the craniosacral therapist would check with the neurologist or anything like that. But that's it. It's so gentle, and that's what makes it really safe. So we can work with the teeny tiny little neonates, which I did. I worked in the NICU, and then all the way to the elderly. So
Yeah, and I'm curious if you worked with any patients who have dementia, where you could use this as a form of relief and give.
absolutely.
Awesome.
Absolutely. And actually my mother is suffering from dementia,
Okay.
as we speak, and Alzheimer's as well, depending. So one thing that I don't know if I've said it, but I talked about restrictions and blockages. So bottom line is we're interested in increased flow, right? So where that tension was in the fascia, there is lack of flow, and that can be blood flow, lymph flow, nerve flow, cerebral spinal flow, energy flow. We're one big electrical panel, right?
Yes.
So again, all the modalities, in my opinion, are just about reestablishing flow. We just go about it a little bit differently. And then we're very interested in cerebral spinal flow. How is the brain being flushed, the spinal cord being flushed? And are we getting good blood flow into the brain and waste out of the brain? And what happens, we see this with children with autism. We see it with people with Alzheimer's and dementia. This membrane that I showed you earlier starts to get really rigid. And so then that starts to cut off or restrict different parts of the brain. It's not getting the flow that it needs. So we find that people respond very well to this work. So if we can help work with that flow into the brain and out of the brain. So sometimes it's one-way traffic is good, but the other's not. So a lot of times people with when the membrane starts to get a little tight, a little more rigid, the waste is not able to flush. And so then we're not thinking clearly. And we can all have some degree of that, depending on how tight our neck is or whether C1 is in alignment. Sometimes I struggle to find my words. I'm like, oh, got to get on the table, because that means only one thing, that I am not, that the flow in and out of my brain is not optimal, right? So I'm so glad you brought that up. It's just, it can be life-changing, really, really. And then, once that happens, the body is amazing. Once the cells and the tissue get to the area once the cells get to the tissue that they're trying to get to, then they can heal it. Right. So again, we're just facilitators. We're just trying to help the body. The body knows what it needs. It just can't quite get to it.
Right. And
so that's a good point.
It talks to us. It tells us by showing up as some type of symptom or sign. And the hardest part often is, okay, what do I do about it? How do I get the correct help? What can I control and change about my body? And so that's truly the hardest part.
It is. And that's why I think a team approach is very helpful.
Right.
And, if you find one good integrative therapist, they will lead you to others. You may find a good acupuncturist, good chiropractor, and a good chiropractor also knows soft tissue needs to be addressed. Same for a craniosacral therapist. We know that the alignment, the cervical spine particularly needs to be addressed, so exactly. I completely agree with you. It's the body will let us know, and sometimes the craniosacral can be that missing piece, and it marries everything because it helps the central nervous system. Then it helps all the other modalities work better, if that makes sense. But sometimes, and I know you experience this, you'll be the first stop. You're the first place that someone's gone that's different, other than what we're told, or a doctor, and that can be just really lovely to kind of see them reestablish a relationship with themselves and be empowered, and then that may lead to other modalities, other people. And I said, what I'll say to some people is, okay, let's get our team together. It's not this is not a one-stop shop. It is definitely part of a team. So
that's amazing. So how can people find someone like you who does craniosacral therapy?
It's luckily easier and easier because this work has been around for a while. It's international. So people are trained like myself all over the world. I am trained through, I've mentioned Dr. Upledger's name earlier, Upledger Institute.
Okay.
And it's literally under upledger.com.
Okay.
So upledger.com.
Okay.
And I trust there are other people that have actually trained with Dr. Upledger and then started their own schools and whatnot. I've been trained through Upledger, so that's what I refer people to. And you can go on there and there's a link that says find your therapist. You put in your zip code. There could very likely be somebody right in your neighborhood, because it's like I said, they may not just do craniosacral, but they've been trained. But once you find a therapist, you can go on and see what their training is, how experienced they are, what their specialty is, and that sort of thing. And like I said, if you have trouble finding somebody that way, if you find an integrative practitioner, often they'll lead you to a craniosacral therapist. So
absolutely,
it's just becoming more, I wouldn't say we're mainstream, but it's getting much, much more that way.
Yeah.
Which is encouraging, very encouraging.
Yeah, it's great. You hear more about it, at least in all realms, not just in the health world, but you've heard it in business groups and just various people who are healing others. And it's great that's becoming more commonplace.
Yeah, that's exciting. That's very exciting because I haven't mentioned, I have thrown out the idea that I've worked with newborns, but one of the things that Dr. Upledger said is that if we could treat every newborn, because we come in either in utero position or the birthing process, we come in with these tension patterns and then we operate around them and add to them. They're just the core of the onion, right? They're the beginning. And he's a big proponent on that. If we could just treat, babies from the beginning, what would the world look like,
Yeah.
And it's just it's the more and more we can start to do that, and before we don't even know what we might be helping prevent, right? Whether it's learning disabilities or um, some significant chronic illnesses that are stacked on top of that because of that early start. So
Right. Absolutely. Well, this is amazing. Do you have, how can people find you?
they can find me. My email's really easy. My website is amyrinkevich.com.
Okay.
And my name's probably on there, right? Because the spelling is
Yes.
crazy.
Yes. Yes.
It's actually just like it sounds, but it's a little intimidating. So amyrinkevich.com is my website, or amyrinkevich@gmail.
Okay. Okay. That's great. And as we wrap,
They can email me. And I would love to. Any questions?
really appreciate that. I was curious, any last minute tips that you might offer someone who's considering this, or anything you might want to offer them about health in general?
Well, I just think follow your intuition, and realize that there is no problem before there's a solution, right? So everything, the body knows how to self-correct no matter what. And if we all believe that, and continue, and that's what I'm seeing people do more and more and more. They don't want to suppress or anymore. They want to figure out why they're having the symptoms. They want to get to root cause. And this is a lovely way to explore this work. So one of my friends who's a craniosacral therapist says it best. She said craniosacral allows us to go where we need to go. So literally it's about kind of dropping in, following, and I'm not the only one. It's not just the therapist following. We're doing this together, right? So then the answers are always in there. If you think about it, all the parts were there that created the symptom, and all the solutions are there as well.
Yeah.
So if I just encourage people to don't feel like you can't get to the root cause, because you can. I see it every day. And it's just really, it's inspiring. If there's a healthy addiction, I have one. I love to receive craniosacral. That's the other thing, is body workers have to get body work, and so I'm a big believer in getting the work regularly, so that I can't help someone go where I'm not willing to go, so team of my own, and I have a craniosacral therapist. And so I think that's really, really important as well. But it's just it can be this lovely way of kind of establishing that respect, for ourselves, and trusting, and feeling empowered, which is then we can take that show on the road, right?
Right.
And we can take that out into our life.
Absolutely. Yep. We have to heal ourselves to be able to heal others. So I totally understand that.
Right.
Yeah.
Right.
Well, I really thank you for being on the show today and sharing your time, your wisdom, your knowledge to all of our listeners.
Such a pleasure. Thank you very much for having me and doing what you do.
Thank you.
Thank you.
Thank you all for watching us today and listening in. I really hope you enjoyed this, and reach out to Amy. She's a great person, and as you can see, full of knowledge. Have a wonderful rest of your weekend. We'll see you again next week. Bye, guys.
Bye.